Okay. Mirror, mirror on the wall. Who is the grumpiest of them all? It would be Dr. Tom Rodolfo.
Everyone, I took a straw poll. We just got back from a grueling 5-day travel period.
To San Diego. We have to cleanse ourselves.
Yeah, we cleanse ourselves at the...
with hamburgers and M&Ms and potato chips and beer.
Right.
Because it's too Southern California for us.
Well, actually, they had really good food there. And
yeah,
just,
pretty good.
And the conference center, if you're listening, they had all kinds of wine and alcohol and all kinds of gluten-free food.
So where were we?
But they didn't have any gluten-free beer. So
That's right.
I had to make up for that last night.
Well, the question is, we're talking about a place we haven't told you about yet. We were just at the SOT Med conference, which is the Society for Progressive Medical Education.
Is that what it stands for?
SOT Med, Society for...
All those days of that meeting, I didn't know what it stood for.
Society of
Progressive
Medical Education.
There we go.
And there it is. I'm tripping on my words, but that's okay.
Anyway, Tom Lowe is head of that organization.
Yeah,
he does
he's a friend
an
of
absolutely
ours. Good guy.
fantastic
Really
job
good guy.
of putting the meeting together.
And he and his family.
And we give credit to whoever deserves credit. Just let us know, and we'll give you credit wherever.
Exactly. But right now, we're going to take credit.
We're
we're going to take full credit for everything. And so this is a meeting, and there's about a 2-day meeting where you have talks and workshops on different themes. We'll talk about that in a second. And prior to that, there are training sessions.
They're called pre-meeting.
Pre-meeting.
It's a pre-meeting meeting.
Yeah, it's a pre-meeting training session. And it's sort of like a 4-hour block where you teach somebody things. And there's one of our friends, Sara Alfaro. She's a doctor in El Salvador. She was doing a class on O2, or O3 rather, on ozone infusions and things like that. So they do a lot of things of that type. Mark and I taught 4 hours, if you can believe that.
Well, we just talked for 4 hours.
Could we go on for 4 hours?
Yeah, we did.
Yeah, we had no trouble with that. They had to bring the hook out and pull me off stage.
Well, fortunately, we were 8 to 12 a.m., so nobody really noticed the first hour because,
Yeah.
Well, it was really basically for us, it was sort of the typical thing. Bob told me he had 10 minutes of material to talk about.
Yeah, so it only took me about 90.
It took him an hour and a half.
It only took me about 96 minutes, I think, to go over my 10 minutes, 5 slides. But what Mark and I will do is we're going to summarize what we did at SOT Med. So this is going to be sort of like a SOT Med redo, a redo, R-E-D-U-X, for the things we did.
Yeah, or at least some of the... Yeah,
some of it. We're going to give you the content, so it's better if you go because then you can actively directly ask questions.
You can actually throw things at us.
You could do that. People have done that.
Throw vegetables at us.
Or you can walk out. You can stomp out and so let me know how angry you are. So that's all that stuff is possible. But basically, we'll go over. We'll just tell you what SOT Med was about, and it's every June, about the middle of June every year. And you could go to these things. So. There was Tom Lowe, who's the guy who was the master of ceremonies. He runs the event. And then there's Stuart Nunnally, doctor of dental surgery, DDS, the teeth and nothing but the teeth, so help me God. So he talks about the importance of teeth, which are very important for health, turns out. And then Chris Shade, who talked about detox and beyond detox and autophagy and detoxification.
Who's that next guy?
Bob Dennis.
Yeah,
that was me.
Yeah, they
I was listed on there, but
on him.
There was a certain person who wasn't listed on the agenda. I'm not going to say who. He's just not important enough. It's just some people are just not as important as others.
Well,
I don't think that way, but it just works out that way.
I got a speaker badge though.
You did get a speaker badge, and we got food for going. So from brain to pelvis, and I was talking about the innovations. Mark and I are going to talk about this a lot. The innovations with PEMF for focal treatment of TBI, incontinence, other diseases, and then there was other people there. Steven Sinatra talked about metabolic cardiology, new emerging frontier. Dr. Zach Bush, famous for a lot of reasons, talked about we are the frontier, future, healthcare, and let's see, what else do we have here? So then we had these workshops and exhibitor visits, and we basically talked about these topics over and over and over again.
Yeah, well, actually, we had some new data from the study that's going on in El Salvador, using both PEMF and the brain gauge, and we got it in a very timely fashion. So I got up at 3 o'clock one morning before we had this workshop. The first workshop, and I actually we talked about the results, and that's what we're going to talk about today. was go over some of those results, and that's part of the workshop that we did. I went to the first one, and I blew the second one off because I was talking to somebody else. I let Bob handle it, so there's no telling what he said.
Yeah, well, not everything was pretty. I mean, I had some hard things to say, but Mark wasn't there, so it was okay. I felt better about it. But then, then there was the next day of this, and they were talking about natural approaches to breast cancer prevention, biohacking with stem cells, the medical cannabis, and microbiome, restorative therapy, and ozone, things like that. Secrets to curing chronic disease, things like that. So it's a pretty good conference, 2 days long. Plus, there's a training,
there's always workshops before, and it's there's people, and you make a lot of new friends and make a lot of connections, and you can talk to a lot of people.
Yeah, there's a lot of new products you can look at.
A lot of interactions for a couple of days. So full days.
It's worth looking at. I think this year, next year, it'll be 2020 June. It'll probably be somewhere around the East Coast.
We're hoping it's one flight away.
Yeah, we're hoping
we can sort of grouch about the travel a little bit. And that was
5.5 hours on a plane. I don't care for it. But anyway, so if it's something you want to go to, you should start looking for SOT Med, SOPMED 2020, and probably starting around January, February is when they're going to start making the announcements for that. And we'll probably be there, unless they don't invite us, which is quite possible. After this year,
there's always a chance they'll tell us to stay home.
I'm sure I pissed a few people off.
That, or they might just want to take it up a notch and make it a little bit better and higher level, and then in that case, we probably won't get invited. So right now we
they
we're trying to slip in under the radar and go talk to people and
Right, exactly. Well, that's basically what we wanted to say. So you wanna go on in this one and talk about our content. We've got a brief intro slide.
Do we have an intro slide?
Yeah, we do. Up? So we'll come back and talk about what we talked about. All right. Here we are.
We're back, and Bob has promised to piss me off, but we'll see.
I'm so good at it. So Mark wants to, and I agree with him, talk about the actual data that we talked about, rather than the same old stuff like here's how the brain gauge works, here's how PEMF works,
which we talked about extensively at the meeting,
right? And so. You're supposed to turn your phone off before.
We never do that.
Never do that. I turn mine off. Right. So the thing is, we're going to show some data. So the first slide that our heads are probably already on it is and this is sort of we're converging on how to use PEMF together with a brain gauge, so micropulse and brain gauge, and then how to use these two things together.
Yeah, and if you're looking at the slide. I keep having trouble getting used to talking to the camera.
I know, because we have slides propped up.
We have slides screen. Right here, which you should be looking at. You should be looking at, and when we put these together, we'll just be talking heads to the grumpy old men.
So don't mind us when we look this way.
Yeah, that's just the way it works. Yeah. But anyway, we're looking over the slides now, and this is the way. If you look at the left-hand column, what you see is a whole bunch of names. Well, what would be names? If you have a brain gauge, you know that. You list all the subject names on the left, and where there you see PEMF, MTBI1, insomnia, diet, PTSD.
That's a person.
Those are just examples of data.
Oh, it's an example.
Examples of subjects that had those
example
conditions.
Subject. Okay, I got it.
They're sample subjects. And if you look to the right, you see the graph of the person that's been selected. And in this particular graph, what we see is that, in the there's 3 data points. One's in October, one's at the end of March, and one's pretty recently in June. This is relatively new, and pretty excited to get this. But if you look at the time chart, what you see is that this was a subject who had TBI, and he'd been sort of bouncing around with a TBI for a couple of years, chronic condition, and his overall brain function score is sort of around 50%, not so great. And then he started seeing a clinician, obviously, because the clinician tested him. And then he got him on a program of, doing a couple of things, trying to clean up his life. And he came, a few months later, he improved slightly.
Slightly. So it's like from the yellow to the slightly yellow-green dot towards the middle.
So we're talking 50 to 55,
Lifestyle
60%.
alone changes went from, 50 to 55%?
Something like that.
Yeah.
But, you know, and then you see the little hashtag there with a information
little hash
bar.
line,
Yeah.
vertical line with a blue dot at the top.
Yeah, and then what that indicates is where PEMF started. PEMF was started, and they put the coils on the head, and, you know, did some treatments there, and voila, you know, up in June, you know,
2 months later.
2 months later, he's doing much better.
Yeah.
And he continues to progress, and he's going to continue. We think he'll probably
combined treatment.
With combined treatments of all the things he's doing, probably keep getting better. And you can, on the right-hand side, you can see the radar charts, or there's individual times where you see the first data point, the first time point, then the second radar chart in the middle.
Not much improvement.
Not much improvement.
Yeah,
and then the third one looks, you filled up the radar chart, it looks a lot better. So that's just a very simple, clean,
just an
example of using PEMF with a few data points, and gives you some time points. And that's kind of what we're interested in, getting people to look at and let us know when you've done that and give us feedback on.
Right, exactly. Okay, I'm going to stop here and go to the next slide. We'll see you at the next slide. Ready?
You bet.
And this is the first slide where we did some data with Sara Alfaro, right?
And
down in El Salvador.
Right. And so all these quirky little things on the left that you see, those are her secret subject IDs, which nobody will ever know.
Right.
And in this case, now Sarah's not looking at head injuries. She's looking at pain.
The point here is, can you do a study using our equipment? The answer, of course, is yes. We're starting to do this now. This is the beginning of our crowdsource recruitment of people and studies, and we're doing this in collaboration with others. In this case, it's in El Salvador, and the idea here is whoever's got pain walks into Sarah's pain clinic down in San Salvador, and she treats them.
And the interesting thing about pain, if you've already suffered through some of our other videos, we've talked about this before.
Then you know what pain is.
Then you know what pain is.
Videos for
but you also know that pain has an impact on brain gauge scores, because you know why? You know the answer to this question.
I do know why.
Yeah. Okay. You're not going to tell it.
No.
Well,
you didn't pay enough.
Somatosensory systems highly integrated. Somatosensory, sense of touch, highly integrated with the pain system. You don't have pain receptors in your eyes or your ears.
Nope, not on that part of your brain, but in
pain
in your somatosensory system you do.
So evolutionarily, we evolved to process pain through that system, and it's highly integrated. So it has a huge impact on how you perceive things.
Right. So the idea is that as we treat somebody's pain with PEMF, how do we see their, what kind of cognitive cortex function changes do we see measuring them with the brain gauge? That's the idea here. And so this is a person who had cervical spine pain, treated multiple sessions. That means, every day for 3 months, they get treated for, what was it, about an hour?
I think so.
It's about an hour every day for 3 months.
And so, starting in November through end of January, and you see when they tested, they started out testing very poorly.
Brain function was pretty bad.
But their final test was actually pretty doggone good.
So why should a person's brain work better when you take care of their pain?
Well, gee, I don't know, Bob. Why?
It just does. It's magical, right? Well, no, we're just telling you, right? There's this integration between pain and, it's in the somatosensory cortex, and that has, that impacts how your brain is.
And the higher level question or higher level explanation is it's all networked. And we get that question all the time. Reviewers all the time will try to slam people for saying, you're just testing sense of touch. Obviously, it's not a really a well-educated reviewer, unfortunately.
Yes, plenty of those.
It's like, why? And they actually ask the same question. You're just testing sense of touch. Why should that change with pain? It's like, we've been doing that battle for as a field, we've been doing that battle for 50 years. Everyone knows it affects
Here's the fact,
function.
right? If you have chronic pain in your back or your leg or wherever it is on your body, you have chronic pain, it's going to influence how your brain works.
Right. We actually have papers on pelvic pain having an influence on how your brain works.
It has a big impact on it.
Yeah.
And so anyway, did you want to talk about this one some more? Go to the next slide.
Let's go to the next one.
Okay, we'll see you in the next slide. Okay, so here's another piece of data that was
Yeah,
taken from
another-
October through November.
Similar
It's
example.
about 6 weeks or so.
And over almost the same period of time,
Yeah.
person received multiple sessions, and this was lumbosacral pain.
Exactly. So lower back pain, and pain was reduced by the use of PEMF, and the result was that their brain gauge scores got significantly better.
Yeah. So let's go to another example.
And now the secret information is revealed.
Yeah.
This is the best. For me, this was the most. As we reviewed this data with Sarah and Mark analyzed it. This one for me was the most telling. So
I mean, some scores are more sensitive than others to pain, and that's the whole point. You know, and people say, why do we have to take so many tests? Why can't you have one test? A lot of people are big on this. Oh, you know, I don't have time to test. It should be a 1 minute test, 2 minute test. Well, okay, our tests are 1 to 3 minutes long, but each one means something different.
Right.
And this is a good example of that. Accuracy measure is really, really highly sensitive to pain.
Right.
And
I did not know that.
That's mainly because one thing pain does is it reduces lateral inhibition. We talked about that before, probably episode somewhere between 5 and 50. We talked about it. Somewhere in the last 50
episodes.
Just binge watch them all, and you'll know.
Time to binge watch Grumpy Science. Okay.
But look at how poorly their score is on the left, and how poorly they're doing on the very first test versus how they scored.
Look at the time too.
100% on the final.
January 16th to the 24th, 25th. So we're not even talking about 10 days really.
Right.
Talking about just, and so these are all people who were treated daily between the tests with PEMF. So they were tested and then treated with PEMF every day. And this one was like 10 days of treatment. So in 10 days, their brain gauge score went from like 35 to 100.
Yeah.
Right.
And I think she said their pain rating went from 8 or 9 down to 2.
9, typically. So she did a ton of people. In fact, 54 people she tested and did, the visual pain scale tells you from 10 to 0, how bad does it hurt. And so most of these people were they started off in the range of 8, 9, or 10. And after treatment with PEMF, they were down in the range of 1, 2, or 3, usually. And so correlated with that are changes in cortical function. And the biggest change that correlates of all the measures that we take with brain gauge is accuracy.
Exactly.
For the reasons Mark stated.
And that's really cool because theoretically it should be impacted the most.
Isn't that interesting?
Right.
All right, you ready for the next slide?
You bet.
Okay, hold on. Here we go. And another example of basically the same effect, Mark.
Yeah, same thing. I mean, again, accuracy improves a lot. And this is over from January to February.
Look at that
daily
data.
Sessions, and the data shows. Now the other scores, maybe they didn't get better because they mean something different.
Could be something different. It could take longer, but the thing that seems to correlate in time and intensity most closely with pain is accuracy.
So one thing we need to talk about is everybody, very commonly with pain, there's a thing called comorbidity.
Right.
And just because you have one kind of pain doesn't mean you don't have something else. It's really common for somebody with TMJD or temporomandibular joint disorder to also have migraine, or somebody with fibromyalgia to have TMJD and migraine.
Yep.
In other words, you can't just pick one or the other, but there are different mechanisms associated with different things. If you have somebody that's got pre-Parkinson's and pain, then you're going to have to deal with both things. And I don't know what this, we don't know whether this patient's going to have pre-Parkinson's.
Well,
see,
this is the thing. This is just the initial. We only spent like a couple of hours with Sarah looking over this data, but it's actually a very replete, very full data set that she has. It's just not fully recorded and certainly not fully analyzed yet. So this is a data set we're going to be going back to more and more. And the other thing I wanted to say about this data is that a lot of these are going to be people that continue on. So we're going to see this is just a quick short-term results, and some of these people we're going to get back with them in half a year, or 2 years,
exactly,
and see how well these things track. But right now, it's very clear that PEMF is having a very beneficial effect on people's pain, not just like one type of person with one type of pain, but this Sara's clinic takes anybody who walks in the door who's got pain. So it's totally diverse. Men and women, any age, any type of pain.
Right. And one of the other things that we talked about in the meeting was that people have different pain. When you have pain in one place, it's really bad. It makes you a little more susceptible to getting pain somewhere else. You treat the pain in one place, and if you keep treating it and gets better, then all of a sudden the other parts of it. And,
isn't that interesting?
One thing you can think of, if neurological health is improved through the reduction of pain, then your body can heal the other things that are wrong.
And your brain
takes time,
and your brain's processing pain better anyways. I'm sure there's a physical thing going on peripherally, but I'm sure there's a big central component where your brain's just handling the pain signal more accurately. All right, are we ready for the next slide?
You bet.
Everybody hang on, here we go.
Also, this is the next slide. In this case, again, pain is treated. And this time we're just looking at the focus score on this person. And just over, a week's period.
I have trouble with focus. Sorry. That was for me. I've been coughing up chunks of Professor Know-It-All all day.
Yeah.
Sorry.
And people,
kind of bad,
a lot of people at SOT Med, by the way, did at the meeting we were at. They wanted to know the secret identity of Professor Know-It-All.
Yeah, exactly. I
and
didn't have the heart to tell him.
We're not going to tell him.
He didn't go down well. Yeah, so we please do not disclose the secret identity of Dr. Know-It-All, because there's some people who are after him at this point.
That's right. They think they got it. But this one, focus or attention, your ability to attend and actually do things, it does go up when your pain goes away. When you've got pain, the only thing you focus on is the pain. It's really hard to pay attention to everything else.
Like my focus has gotten a lot better too as my pain has gone away.
Squirrel.
Squirrel.
Yeah, see how he is?
I'm okay. No, you just quit doing that to me. I'll be better, all right? I'm getting better. So a squirrel? Okay. So anyway, the deal is this. Think about it it's like what we're telling you is almost like common sense. Okay, so you're in a lot of pain. You've been in a lot of pain for a long time, and that makes your accuracy and your focus lower. Is anybody surprised by that? The answer is no. However, has anybody measured that? I think the answer is also no. Right?
Actually, we have.
Well, we have, and so here it is. Anyway, very clear.
Ready for the next slide, then?
All right, ready for the next slide?
Yes,
Hold
there
on.
are more. You suckers.
It's never going to end. You might as well just settle in.
Take two.
Take two, because I screwed up the first take. This is a rare case in which I was so embarrassed I couldn't make it public. So the real deal here is there are things in the world besides PEMF that you can do, and one of them is called BARRAS, BARRAS, which is a bioenergetic method involving touch on the cranium and stuff like that a lot of people find very relaxing. And so Sara does that in her clinic. And
right now, the study that we're doing with her, with the people that are doing these sessions, we're doing a very short test, or we're focusing on just a couple of scores. So, but mainly short in duration, before and after a 1 hour session. That's why those two dots on the timeline are right next to each other.
Middle of the day, December 5th, right?
Notice they're both on between December 5th and December 6th. So, that's all done on the same day.
Right.
So basically, this is looking at temporal order judgment, or TOJ, or as some people say, what's that Taj measure mean?
Taj, that's a Taj Mahal.
Yeah.
How much you have an image of the Taj Mahal.
It means temporal order judgment. It's your ability to tell order. And it's got more to do with frontal, prefrontal cortex, where stress and anxiety have a huge impact.
Right. So look at that change. It went from practically nothing, like 0 on the cortical metric, shot up in the same day after 1 hour of treatment.
Yeah, up to like 75 on this one.
So their stress and anxiety level went way down. Their cortical metric went way up, like 75 points, right?
Yeah.
Roughly in an hour.
Right.
That's
their focus score also went up.
Right.
And again, like we mentioned before, focus is tough to do with pain. Also tough to do when there's a lot of stress and anxiety. Exactly. So this particular technique, in this case, we're showing it by itself. Sometimes she does it in conjunction with PEMF.
Right,
It
exactly.
just depends whether you're looking at long-term or short-term changes.
But this is something you can do like in, an hour. It's this bioenergetic technique, and certainly in a very short period of time, it had an impact on brain gauge scores. So, you ready for the next one?
You bet. Okay, so Bob wants me to do this one, so we won't have to do but
I don't
one
want to
take.
screw anything up again.
Well, we'll just do one take on it. But again, this is, in case you remember the last slide, the dates are the same. Different patient though, completely different person. And again, this time this person went from 20, 30% up to 100% on their TOJ score. So their stress and anxiety got much relieved from this one session.
1 hour.
One hour session. Yet we can still measure that change. Pretty cool.
Exactly.
Huh?
So yeah, it's pretty remarkable. And just look at they're almost the same. You almost can't tell the difference between this slide and the last one, because they started the same place. They ended up basically in the same place.
Yep.
Just slightly shifted up this time. Anything else on this slide?
That's enough
for
that slide.
Hold on for the next slide.
All right. So different date, different patient. Again, same kind of bioenergetics treatment. But again, look at it. We're not looking at TOJ, which is stress anxiety, but focus actually improves quite a bit with this stress relieving technique. And that's probably a much better method than what I found in the literature. In the literature, there's a lot of things that actually enable focus. You know what one of them is?
Oh no, I know. Yes, I do.
Now this was done back in the 60s
Spoiler
or
alert.
70s when people could do real experiments.
Never seen Ghostbusters. Spoiler alert.
Electroshock. Negative feedback with electroshock.
Yeah.
And, if you're too slow, you get shocked. It actually makes you better and make you more focused.
Can't do that anymore.
Yeah. So but I guess we have to depend on other ways to get people to focus.
Yeah. Okay. Well,
That's
you
good.
can see definitely an improvement in focus there with BARRAS. Okay. Next slide. So then, we're talking about things that were done sort of in one day there. And then the question becomes, how long can this kind of a thing last? So there's longer term treatments with this energetic method. And I think they use PEMF on this one too, correct?
Right. I think so. And the bottom line is one of the questions that we got from the audience when we were showing the BARRAS treatment of the previous slides, where we're talking about stuff that changes over time, they say, do those treatments last? And this is an example that, well, sometimes they do.
Sometimes they do. So then the question is, you're looking at other modalities like this energetic, basically it's like they're almost getting a scalp massage from a skilled person, and PEMF. And there is some indication in the literature, in the scientific literature, that PEMF is unlike most other treatments for pain, where the results from PEMF, if you do it a few sessions, can be very long lasting. There's at least one paper that shows that it reduces hematomas and other things in rabbits for up to 3 years.
Wow.
So it's not like TENS and some of these other treatments. You do them, or or taking opioids or something, and then you stop, and the positive effects go away. Like the negative effects can linger for the rest of your life for opioids, but the positive effects tend to go away. However, what we're showing, and the idea here would be, you have a longer term benefit from the BARRAS or PEMF, and then you get longer term benefits to cortical metric scores as well.
My focus is clearly slow, because once you mentioned rabbits for 3 years, I started wondering, wow, do rabbits live 3 years?
They can.
So
not
with hawks around.
No, with the hawks around. In the wild, they don't live for 3 years, I guess, very, very much, but they definitely do. And this was pretty much the entire lifespan of a rabbit. PEMF took something that would normally have been, measurable in their entire lifespan, just wiped it out, and it never came back. So, the question is, the general thought here, the data is starting to firm up and show us, well, the positive effects of PEMF and these other things are long-term. We can measure them.
Yep.
Right?
All right, take one on this slide.
Again, we have to have Mark lead it off, otherwise we have to retake it.
Well, we're also looking at this method in conjunction this time with PEMF. Helps with pain management this is lumbosacral pain. And notice this is the accuracy measure again. it takes a while. Sometimes it takes a while for things to kick in.
They didn't see much improvement for the first week.
Yeah, very little improvement.
They started to see some real improvement.
Right.
We see that in PEMF sometimes, right?
If you've got a debilitating pain problem for a couple of years and it takes 2 weeks.
So this is lower back pain, lumbosacral. And the first week, it was still pretty bad for the first week, but if you stick with it.
Yeah. I mean, and their pain scores, again, went from 8 or 9 down to
on this
2.
one, I think she told me on this one or another one, it went from like 9 to 2, which is a huge change in pain. And that's without pain meds. So that's a big deal.
Yeah.
Okay, so we got this one covered?
Yep.
Alrighty. Well, that kind of wraps up our first set of data. We're going to talk a little bit about crowdsourcing next. But before we get to that, we wanted to leave you with a few take-home messages here. Which are
one is Sara provided us with a lot of data, and this was all collected on stuff that she normally does. This is the way she treats patients, and so to treat patients, if you really want to get an idea about how they are progressing and how their brain function is progressing, it doesn't require that much more overhead, very little administrative overhead to try to basically, it's my fault for
as long as you don't got a phone,
we'll just keep rolling.
We'll just keep rolling.
Anyway, but basically, it doesn't take that much effort to get a measure of brain function and to get sort of a tag into how well they're doing and which components of brain functioning are actually working. So, in other words, she's just conducting her clinical practice as usual in standard care, and all she's adding to it is a small study. That's really what we're trying to encourage people to do.
She's able to quantify an effect that's measurable and repeatable on things like pain, right? But how do you measure pain? There's no painometer that really works.
Right.
And stress and anxiety and other things she also measured. So it's like these things that are otherwise quite difficult to measure, you can actually get a number that's a pretty good proxy for them. And also, with PEMF, we're getting pretty good, and other methods, we're getting pretty good clinical benefit. So this is the beginning of a really long open-ended study that we're doing with Sara Alfaro down in El Salvador to prove, that in a large, diverse human population, as people walk in off the street, not picking favorites, not, no cherry picking on the data, that we can actually measure these people, and that in either one treatment or multiple treatments, we can do things that really improve their status for pain, anxiety, stress, and that has a big impact on their brain function. And as this study goes on, we'll be able to show that this is something that's a long-lasting benefit. It's not just for the afternoon or something.
That's right. So anyway, we'll talk more about crowdsourcing, which does not mean we're looking for money.
Yeah, it means our term, crowdsourcing is we want the crowd to help us think about and collect information on something. We don't need the money.
You could say Sara's one member of the new crowd. So she's collecting data, and we're helping her do research and report it.
When we talk about
methods work.
When we talk about crowdsourcing, we're actually talking about giving other people, everyone who's interested, the ability to engage in a project, and then we crowdsource that information and that understanding. We take it in aggregate, and what kinds of things can we actually say? What kinds of things can we actually do? And that's what we're doing. Okay, so we'll do that.
We've talked enough for a while. I mean,
this
is like a 2-hour video by now?
Maybe
so
2 or 3
whatever.
hours, something like that. If we cut out all the mistakes I made, there'll be about 15 minutes. All right.
Okay,
We'll see you later.
Ya.